Hello, my name is Moses Vikala. I'm a sonographer, or the person who does scans at MedSafe Hospital. I'd like to talk to you about the mid-trimester scan, or the scan that we do in the middle of your pregnancy. This scan, the mid-trimester scan, is a standard exam during your pregnancy, which is usually performed at around 4.5 to 5.5 months. I say it is a standard exam because it is part and routine to have this exam as part of your care during pregnancy. This ultrasound scan checks your baby's physical development. Those are the structures of your baby, screens for any abnormalities that your baby may have, and also estimates the gestation age or the period of your pregnancy. This exam can also provide information about these things: your baby's position in the womb, your baby's movement, breathing, and heartbeat. It can also estimate your baby's size and weight. It can estimate the amount of amniotic fluid, that's the fluid around your baby. It can also tell us the location of the placenta, which is a structure that supports your pregnancy, that supports your baby in the womb. It can also tell us how many babies or fetuses you are having. And if your baby is in a good position, we may be able to tell the baby's sex. This scan is usually routine, or it's part of your pregnancy. And if someone could only afford one scan, this is the scan that would recommend them to do. The scan between 4.5 to 5.5 months. Why do we do this scan? The scan is done to check if your baby could have a condition that affects their health and development. If there's anything wrong in their development or the organ is forming, this is the scan that will tell us. Your baby can also be checked for signs of different abnormal conditions that they could have. Some conditions are seen more clearly than others, but for other conditions there could be additional screening that may include blood tests and the doctor's examination to find a way forward. We also do the scan so that we can see the placenta, or the structure supporting your baby, and the blood flow to your womb so that the baby can be growing properly. How do we do this scan? This scan, like I said, that is done between 4.5 to 5.5 months. These are done at local hospitals or clinics or health centers by a trained healthcare professional. So some of the professionals here include sonographers like myself. We have radiographers who do ultrasound exams plus other procedures. We have imaging technicians or technologists, and we have radiologists. This scan usually takes around 30 minutes. And there's no known risk to you or your baby from the scan. When I say this, it means we've studied and we've not found any serious injury or risk to your baby's development or to you yourself. The scan sometimes may take longer if your baby is very active during the exam or is not in the right position. Some positions are much easier to get clear pictures than others. And if your baby is too active or is in a difficult position, we may ask you to go for a walk or to eat something. Then you take about 10 minutes and you resume the scan. And if it is still difficult to get the pictures of your baby that day, another appointment can be made. Before 6 months, I remind you that this scan, yes, looks for all structural abnormalities, but it's hard for it to find all conditions. But if you have any symptoms that you're worried about, if there are any concerns that you have, or you do not feel okay, it is important to talk to your medical care provider like a midwife, a gynecologist, a general doctor. They can help you. How do you get the results? Most of the time you'll be told the results of the scan after the scan is done, after the checks have been done. And most of the time mothers will be told your baby does not have any signs of a condition or signs of an abnormality. But unfortunately, sometimes some people may be told their baby has signs of one of the conditions or one of the abnormal conditions that can happen. And what do you do when your baby has been found to have an abnormality or an abnormal condition? First, you'll be told if there are signs that your baby has a health condition after the scan. And if the scan finds something abnormal, you may be offered more scans at later days to monitor the situation, or you may be offered more tests that include blood tests and other tests that may be done on the amniotic fluid of your baby. And there's a need for referral to a specialist. These are the specialists we refer you to, include obstetricians or specialists who deal in pregnancies. And in Uganda, we have gynecologist obstetricians. They do the same thing. Sometimes we may refer you to a pediatrician or doctors who specialize in children. Some of the images of the scans that we do. So we start with the baby's head and of course the brain inside the baby. We must see that your baby's brain is developing at the normal rate and all the structures are forming at this stage. So these pictures are labeling the different parts of a normal baby's brain on the scan. Next we look at still the head and face. We talked about the head. Now we look at the baby's face. You have to look at we have to see the eyes. Like here, these are a baby's eyes on the scan. Both eyes are well formed. And this is a baby who is seen from the side. We have to see that has a normal profile of a human face. So we have the forehead, we have a nose peeking here, we have the lips and the chin. And you can also still see the back of the head and the brain matter inside the head. This is a normal baby's face and baby's brain. Of course, we shall also look at the lips and nose. You've heard of babies who are born with the cracked lips or with a cracked nose. This is the scan that helps us see those things before time. We are seeing representation of the baby's nose and lips. Then here, this is the scan of that baby. We have a nose with the nostrils on it. We have a normal upper lip and a normal lower lip and a normal chin. Then we also have the eyes in the diagram, which are also seen on the scan. So these are the things that we look for when you are scanning your baby at 4.5 to 5.5 months. Nothing is left unturned. Of course, next we shall look at the baby's neck to make sure there are no abnormal things growing in the neck or there's no cord around the baby's neck. But also have to look at the spine or the backbone from the buttocks up to the neck to ensure the bones are well formed, all of them, and the spinal cord is also well covered. At the bottom, we are seeing a baby's hand with all the 5 fingers that were seen on the ultrasound scan at this period. Of course, we shall also look at the baby's heart, which is a much more complicated structure. And the commonest that we sometimes show mothers here at MedSafe is this normal heart with 4 parts. Our hearts have a left side and right side, all with 4 parts or chambers that connect. So this is a normal baby's heart with 4 chambers. And this is important because it tells us, yes, at least your baby doesn't have a major abnormality at that stage. On the left here is your baby's abdomen, or a cross section of the tummy of your baby, where we can see the stomach. Your baby drinks water, that's why the stomach looks black with fluid. We can also see your baby's liver. And also at a lower cut or a lower stage from this, we are able to look at your baby's kidneys, baby's intestines, bladder, even the abdominal wall or the navel where the cord inserts. You have to make sure that there's no abnormality there. We shall look at your baby's gender. I know many mothers come wanting to know the gender. And please mothers, 4.5 to 5.5 months is the best time to tell your baby's gender because all the structures are well developed and differentiated compared to 3.5 or lesser months. So on the left here we have the genitals or the private parts of a baby boy. You can see this white structure here elongated is the penis of the baby, and the round structure at the bottom are the baby's testicles. That's how we see a baby boy. On the right, we are looking between the thighs of a baby girl, and there are 2 structures between the legs that are separated, and that's the external private parts of the baby girl. We also have to look at the legs from the thigh to the toes. This is a normal leg from the knee up to the foot. This is a normal shape of a baby's foot. And if you look at the feet from beneath, we are able to see the heel or the back of the foot and with all the 5 toes. Other structures that we will look at during this 4.5 to 5.5 months, the placenta, this gray structure, which is a very important structure that nourishes your baby and takes our wastes from your baby. This is how you and your baby are able to communicate, and you're able to support your baby by this placenta structure attaching to the uterus so that it can sustain the pregnancy. We are seeing something with the colors. This is the umbilical cord. It's how your baby gets nutrients from you through the placenta, and how the baby's waste is eliminated from the body through the umbilical cord to the placenta and then to you. Of course, this is a standard exam, but we are also able to always look for any other structure or any other issue that may disturb you, like fibroids or the cervix. That is the opening of the uterus. We are supposed to assess it to make sure it is closed and it is long enough to be able to support the pregnancy. Then the dark area here, we are seeing the picture. This is amniotic fluid. Usually we have a way of estimating whether it's enough. We don't want it to be too little and we don't want it to be too much. And this now concludes the mid-trimester scan, and which in summary is the scan that is done between 4.5 to 5.5 months to look at your baby's development. Is your baby growing at the normal rate? Is your baby's size normal? Is your baby's structures developed? The brain, the spinal cord, the heart, the lungs, the kidneys. We look at all these structures. They are very important to make sure that your baby's structure and development are growing at the normal rate, and to also make sure your baby has all the structures. And if unfortunately there's an abnormal thing that is found, of course we inform you and we refer you to the appropriate people for further counseling and further management and any other tests that they can do to help you. And for some cases, if there's a need to repeat this scan to monitor an issue, we advise. Apart from the pregnancy scans that we do, we also do other scans in women who are not pregnant but they have complaints of pain, of heavy periods, of painful periods. We do ultrasound exams or scans to assess that. Of course, we also examine the abdomen or the tummy if there are complaints in the tummy. Maybe somebody's tummy is feeling painful, or they feel it's too huge for them, or it's bloated. We also assess fertility issues in women and in men. Yes, in men we will do scrotal or testicular scans that can give us some information about their ability to be fathers. We also do examinations of the breast to screen for breast cancer, and ultrasound is an important tool there. We do prostate scans that help us assess the size of the prostate and can also help screen for prostate cancer in addition to the blood test. We also do tests like kidney examination that help us look at if somebody has an issue with the kidney or an infection with the kidney. And of course, the general abdomen structures like the liver. If you're worried about your liver, maybe you've heard of hepatitis or you've been drinking for so long and you're worried about your liver health, an ultrasound scan of the liver is the way to go. We do also assess all other structures like the muscles, joints, especially among young people who do sports. If you feel you've suffered a shoulder or knee injury and the x-ray says you're normal, the scan is the way to go. We can look at the structures of the joints, and if there's an issue we can let you know. And apart from this, we also do scans of the heart, which we call echo. We do ECG, is also an examination of the heart. We do scans of the blood vessels. Yes, members, people can have diseases of the blood vessels, and these scans are done here at MedSafe at a very fair price. And we also, apart from scans, we also do X-ray examinations. There's a department for that. And under X-ray we look at the back, people with chronic back pain, people with chronic joint pain. These services are here. And for people who've done scans from somewhere and they are still not conceiving, yet the scan said they are normal, we have a test called HSG, which looks at the tubes to assess whether they are blocked or not. And this test is important in telling us if the tubes are able to help with conception or they are not. Thank you very much for listening. God bless you.